Welcome to Practice Pearls, Overcoming Therapeutic Inertia. Today, we're going to discuss finding diabetes support resources in your community. I'm Dr. Neil Skolnik, Professor of Family and Community Medicine at the Sidney Kimmel Medical College of Thomas Jefferson University. And joining me today, I'm privileged to have Dr. Dave Morrero, who is Director of the Center for Border Health Disparities at the University of Arizona. He has also served as Associate Editor for Diabetes Care. He was selected the Outstanding Educator in Diabetes in 2008 by the American Diabetes Association. And in 2015, he served as the President for Healthcare and Education of the American Diabetes Association. Welcome, Dr. Morrero.
Thank you, a pleasure.
Just to level set, remember that therapeutic inertia is defined as the failure to advance or de-intensify treatment when a patient's therapeutic goals are not met. Dave, recognizing that we're going to be doing a separate video on diabetes self-management and education support, today I want to focus on getting support for other types of barriers, things like social determinants of health, mental health, financial, travel, etc. Let's start with if you can go over why diabetes community support resources are so important.
Sure. Diabetes is unique amongst chronic conditions in the degree to which the individual with the disease actually can chart outcomes. And there are so many aspects of your life and behavior that fit into that bundle. So you have a lot of things that go on with diabetes that are really lifestyle issues and behavior issues and mental health issues. And that's not always handled by your primary care provider.
That's a really good point. And they say it takes a village to raise a child. In many ways, it takes a village, is what you're saying, to manage a patient with diabetes because there's so many diverse things. Why is it important for clinicians to have a list of resources available in their community that they know to be reliable?
It certainly is a useful thing to have that list. I wish more did. In my area of the country where we have food deserts, I live in Arizona, out in the desert, and there's not a lot of access to different types of foods. Knowing that you have a community food bank, as an example, would be a useful thing for a provider. And oftentimes, providers who do know this recommend it to their patients. This is a place where you can go and get support in feeding yourself and your family, which is not always easy to do in my part of the world.
What are some other resources that you think are important for us to think about and develop a list for in our community?
Because of the unique behavioral involvement in diabetes, I think having mental health access is very important. And finding out resources where you could send people for things like anxiety or depression is a very valuable tool. I think that social services that can help you with economic issues, making sure that you can afford medications, that you have transportation to pick them up is a very valuable thing. And there's a very big list. We could talk all day about that.
It's interesting. The barriers really vary by practice setting. 5 years ago, the barriers I know in our office were much greater than they are now as we've moved to a medical home model and now have a social worker as well as a psychologist embedded within our practice. And it just makes it so much easier. If you don't have that model, you really have to make more of an effort to both find those resources as well as follow up with patients to make sure they're actually able to make those appointments when the appointment is with someone down the hall. When you think about evaluating the resources, are there any things that you think about? So for those of us who don't have a medical home model where we know the person down the hall, any suggestions about how to evaluate whether we're sending patients to someone good?
I think that there are resources one can draw upon that are very valuable and that have done some of the vetting. So for example, going to your local public health department. These are people that have spent time in the communities working with people with different social and physical issues, and usually have a pretty good handle on what are resources within the community that could be accessed, either for pay or for free, which is quite important. I think the other thing that you can do, this will sound a little crazy, but I'm a big fan of using social media to get some feedback about the performance of different resources. You can go to Yelp and ask people about physical therapists, for example, or podiatrists, or for mental health support, and you can see reviews. And while they're not the be all and end all, oftentimes, they still give you a sense of what you as an individual may feel comfortable in engaging.
That's a fantastic idea. I actually haven't done that, but now look forward to doing that. Uh, any other general points that you think are important in terms of finding resources or recommendations to patients for referrals?
Yeah, there are more and more access sites that one can tap. There are what they call 211 sites. It's actually an entity that does look for resources and bundles them and helps people make connections to them. And they come under the rubric of 211. If you go online, you'll find that, and they will direct you to those areas. I also think sometimes talking to other patients about where do you go for this, or have you ever encountered these issues, and what would you recommend to tell your other patients about, is a good idea. I mean, patients live with this day to day.
Yeah, I know for myself, some of the best resources I've found are when patients come back to me and say, I've seen this psychotherapist, or I went to this dietitian who's changed my life. And I always say, who is it? Do you have their phone number? And sometimes actually reaching out and just talking for 5 minutes over the phone with that person tells you a lot about the type of individual they are, what their philosophy is about taking care of patients. So if there is an important take-home point on this issue of resources, and we've talked about the importance of food banks, finding dietitians, psychologists, and other resources, if there's an important take-home point for our viewers, what would that be?
I think the take home point is to appreciate that diabetes is a lifestyle disease. It is a approach to how you conduct yourself in daily activities, and that to not be afraid to ask about different issues like mental health, like financial support, like educational understanding and health literacy, things like that that are important to the individual, and not just assume that if you tell them to do something, they're going to do it. There's a lot of barriers, a lot of things that are going on, and to then gravitate towards finding those resources so you can provide them to your patients. Diabetes is not an acute illness. It's a chronic condition, and it's unique in chronic conditions to the extent which I, as the patient, control what the outcome is, right? So the relationship you forge with your patients is critical, and understanding that issues will evolve and change and morph over time, depending upon what's going on with that individual's life. So you have to be prepared to ask the questions about their experience with diabetes, and not just what is your glucose today and what is your blood sugar today, and can we tweak something and make it a little bit better. That's what was done for 40 years, you know what I mean? And while it's important and I get the value of it, it negates the life experience. And, I've had type 1 diabetes 45 years. I walk the walk and talk the talk, right? I can't remember the last time that my doctor asked me about medication side effects, as an example. You know what I mean? And they prescribe stuff willy-nilly, but they never tend to follow up and say, how's that working for you? They're looking at the biologic outcome, and not necessarily that it causes me impotence and it makes my wife unhappy, that kind of thing. And so there's a lot of that stuff going around in this game. And so if I had to have a punchline, it'd be, look, Mr. Provider, if you're going to take care of diabetes, understand that it's chronic, that it changes over time, and that your patients oftentimes need support that's not pharmacologic. They need support in their community, in the places where they live, and your job should be helping them navigate that.
That's fantastic. And it's really not just about medicines. It's about all these other pieces, of which medicine is one. Dave, thanks so much for joining us and going over these critical issues today.
My pleasure.
For more on overcoming therapeutic inertia, just go to therapeutikinertia.diabetes.org. For the American Diabetes Association, I'm Dr. Neil Skolnik. Thank you all for joining us today.